So, good afternoon, everyone. My name is Chad, and I'd like to introduce you to Tia, your daily personal assistant and appointment keeper. Tia is a low-tech solution to support you through your early-stage diagnosis and to give your caregiver the ability to help you as your illness progresses. For those with early-stage diagnosis, Tia helps take control of your daily schedule and gives you positive reinforcement throughout the day. It sends reminders and encouragement to help you stay independent for as long as possible. As the disease progresses, your support system can access your account and in order to monitor your current state and help keep you on track throughout the day. This means that family members who are separated at a distance are able to provide active support when you need it. The software, if you have a phone, you can get Tia. Tia is not limited to cell phones. There is also a text to landline component for those who need it. The site is mobile ready and designed according to the National Institute on Aging's guidelines for seniors. Without further ado, I'd like to show you Tia.
And I'll just say a few words on the actual design of this website. We wanted to make it very simple for users to use. So anyone with early stage can get on and start using it right away, a caregiver or even a family member. You'll notice the icons are very big. We could have also created this as a single page application. We decided to break the pages up so that there's limited options on each page. And as you're seeing now, you can schedule out texts whenever you want. But the whole idea is to make this design very clean, very simple to use.
This can be a heartbreaking illness that can make achieving daily tasks a challenge. Tia is here to help you with just that, with support and encouragement, so at the end of the day, you could say, "Today I achieved."
So you're envisaging this as something people who have a diagnosis will go and interact with every day?
Ideally, yes. When they get diagnosed, they will start to use the app and help manage their day-to-day. As their illness progresses, a caregiver can then take over and be immediately up to date with that person's schedule and help them throughout by putting more schedules in for them.
So when they achieve a task, the information about that, is it stored or does it just go away as each day ends?
We are definitely storing everything and keeping track so a caregiver can see at a glance how their patients are doing. So the idea is caregivers can support more people and can see at a glance how they're all doing.
Right, so basically it'd be possible to look over time for yourself or somebody that you care for if there's been changes.
Exactly. The idea at later stage would be to have it so the text requires a response. We don't want to annoy the person, but if there's an important text that goes out and you want to know that they took their medication, we can set it up so that they need to respond and the caregiver can then see that that text was responded to and they've actioned that task.
Can you speak a little bit to the positive reinforcement? So how is it? How does that come out in the design?
So we talked about a few ways. What we wanted to do was do a good morning message, so something to greet them into the day, and possibly something at the end of the day to acknowledge what they've done that day, so they get a positive message in the morning and a positive in the evening. So we want to just keep them happy throughout the day as possible.
Is it going to be a paid app, and what's the business model for this?
Yeah, so the infrastructure is built on Twilio, and for us to run this platform is less than a cent per text. You think about that, if you think about that, for $10, that's 1,000 texts. How many reminders does a person with dementia need every day? There's a huge margin there for a very inexpensive way to use this.
I'd also like to add, we use Twilio. Hosting, if you do win with Linode, 4 years would definitely cover hosting a type of service like this, so it's very cheap to actually. And if there are sponsors, text messaging is very cheap, so possibly it can be free for the patient and paid for caregivers to support multiple patients. So. Thank you.